Nicole, in your experience, what differentiates Altasciences from other CROs and CDMOs?
Yeah, I would say integration. And I'm talking about real integration across the phases of early drug development. And this is something that has been talked about for quite a while in the industry and been very hard to realize given the very different focus and expertise at each of those phases. And at Altasciences, the connection between our manufacturing group, our preclinical facility, our regulatory team, our clinics, it's real. Our leadership isn't siloed into each of those spaces. Our chief operating officers cross those lanes and they drive our mission of integration by building functional and human connections between the groups. Having worked with many CROs and sponsors throughout my career, I see in Altasciences one of the most conscientious teams of people who aren't here to just get the work done. They care about getting it right and they continuously learn how to do it better.
How much flexibility do sponsors have with the scope of work they can conduct with research support services?
So we are happy to support our sponsors in any way that we can. And sometimes that means full services with protocol development, clinical conduct, bioanalysis at our facilities, and our full services of data management, analysis, and clinical study report. And we love that. We love to provide the full picture. We gain efficiencies that really support the whole of the study. Other times we work with the sponsor's preferred clinical sites and analytical laboratories, and we provide our expertise in protocol writing, data management, biostatistics, or pharmacology. And in other scenarios still, we work with the sponsors to complement their in-house teams or their other preferred vendors to fill in gaps. And this could mean providing one or several of our services in a collaborative and flexible model that will best meet the sponsor's needs.
Can you talk a little bit about how and why your team works in tandem with clinical, preclinical, bioanalytical, and manufacturing services at Altasciences?
So, with our focus on supporting programs from the earliest phases of drug development through the clinical proof of concept, we have an ongoing dialogue and a collaboration between our preclinical, bioanalytical, and research services teams to prepare for the handoffs that will need to take place through that development continuum. This means as the preclinical studies are conducted, our pharmacology team is supporting toxicokinetic analysis of the drug concentration data from our bioanalytical team. They provide interpretation that will inform the subsequent studies and also the development of the clinical study designs as we're moving forward. As that preclinical data is becoming available, we're able to act on it. And the pharmacology team, medical writing teams, they collaborate to prepare for that jump into the clinical study. They can use the preclinical data and prepare the first-in-human study protocol, advise bioanalytical method development, and that prepares our sponsors for the regulatory submission and the advancement into the clinic as safely and rapidly as possible.
On that note, what are some of the benefits of working with a single service provider for early phase drug development?
So this internal efficiency directly translates into overall timeline reductions. Over the course of a clinical study, our research services teams take advantage of strong internal systems and processes that just aren't in place when you have multiple providers coming together to deliver a study. Protocol development can take longer and require more discussion when working with an outside clinic. The data management team, they end up spending more time educating outside clinical sites on our database and expectations. The biostatistical programs, they're not able to use our efficient library of programs and macros when the data are received from outside databases following unique specifications. And our medical writers, they need more time to adapt data outputs provided by external vendors and integrate them in the clinical study report. Now, we can absolutely adapt to any of those scenarios. It's just that the lack of integration simply limits efficiency and it costs our sponsors time. In our integrated offering, we move efficiently and we hit key study milestones like database lock or top-line data delivery quickly.